T3, this patient succeeded on DTE.
So we were just saying that you were started on the levothyroxine after you received the radioactive iodine for your thyroid condition, and that was some time ago. And then you were put on the levothyroxine, right? And you were,
Yes.
how long were you on that?
Quite about 10 years, I believe.
Mm-hmm. And you continued to have issues?
I did. I had, continual like cold feet, cold hands. I was no energy.
Mm-hmm.
It really didn't work, that one with me.
Right. And you tried different preparations?
Yes.
Yeah.
Mm-hmm.
And then about how long ago did you switch?
About 4 years ago.
You switched to the DTE?
The DTE, yes.
Right. And how have things been going since then?
Actually, they've been going pretty good. I feel pretty normal.
Mm-hmm.
I've had no problems.
What sort of improvement did you notice?
Well, I've had normal energy levels. I don't get the cold feet, cold hands.
Mm-hmm.
I would say pretty normal.
Great.
Yes, it's working.
Thank you.
This patient has been successfully treated with T3 and T4 for about 13 years.
Can you just tell us real briefly about your experience with adding T3 to your thyroid hormone replacement?
Yes, I've been on thyroid hormone replacement for quite a while now, and adding the Cytomel really helped increase my energy.
And how many times a day do you take it?
I take it once a day, 5 days a week.
And since you started, you did notice some benefits?
Yes, a big improvement in energy.
After 15 years, the addition of T3, in this case, helped substantially.
So can you just tell us real briefly about your experience with thyroid hormone replacement?
Yes, I've been on the Thyroid for I think 15 years, and then I was put on the Cytomel, which helped tremendously. That I was able to tweak in the morning and the evening time, depending on how my mood swings were, my weight gain, or anything.
Did you notice any change in your overall energy?
Yes, definitely.
And how long have you been using the combination of the levothyroxine and Cytomel?
At least 15 years.
Thanks.
This individual failed to improve on T4 plus T3, but did so after switching to DTE.
So can you just say a little bit about your experience with thyroid treatment?
I had radioactive iodine. After that, my thyroid had gone low, so they started me off on the levothyroxine, which did not seem to stabilize me at all. Every time I was going to the doctors, it was up and down. After that, I went to the T3 and the T4. That did not do any good for me, so I started on the...
What kind of problems were you having?
I was not able to stay awake. I was very tired, fatigued. There were times that I would go to sleep and then I'd wake up a couple hours later and not be able to go back to bed.
Mm-hmm.
Caused for a long work day.
Right.
So after that, I started on the DTE, and that's when I started to stabilize and have more energy, be able to function every day.
Mm-hmm. And you mentioned something about moods.
My moods kind of were very sporadic, so those stabilized where I was able to not have the highs and the lows. It just stabilized.
Mm-hmm. So you've been on the DTE for how long?
I think I've been on the DTE for somewhere around 8 years now.
Oh, great. Okay.
Many individuals with hypothyroidism do perfectly well on levothyroxine, but for those who don't, these videos may help to open a discussion about alternatives. We hope you find what you're looking for.